Hi friends, I am Dr. Pratap Singh Rathod. I have done MA in Forensic Medicine. In today's video, we will start with therapeutic poisons. That is poisons, mainly tablets or any tablets which is given for treatment purposes, which becomes poisonous when taken in large doses. Among them, first group of tablets are the anti-analgesics and antipyretics, which are used for relieving the pain and decreasing the temperature, decreasing fever. So those are classified into salicylates like anti-acetylsalicylic acid, diflunisal, pyrazolones, indolacetic acids, phenylpropanic acids, anthralic acids, oxycams, phenylacetic acid like diclofenac. Among them, first commonest is the salicylic acid and their derivatives. Salicylic acid preparation of salicylic acid includes like sodium salicylate, methyl salicylate, and commonly used is aspirin. Sodium salicylate is odorless, white, scaly crystals with unpleasant saline taste. Methyl salicylate is colorless liquid with aromatic odor and sweetish taste. Commonest, which commonly used for pain relieving analgesic or antipyretic, is the acetylsalicylic acid, or commonly known as aspirin, which is a white odorless crystalline powder having slight acidic taste. It is popularly used as an antipyretic and analgesic. It acts primarily through inhibition of prostaglandin biosynthesis, so it decreases the synthesis of prostaglandins. They are rapidly absorbed from stomach and to slightly extent from the small intestine, metabolized in the liver, excreted through the urine. The half-life is about 2 to 4 hours. They can cause irritation of GI mucosa, leading to increased gastric secretions. Coming to side symptoms of acetylsalicylic acid, large overdose of acid or methyl acetate causes mild burning pain in the throat, stomach, and can cause vomiting. Sweating, slight increase of temperature may also occur. Later on, there is signs of anorexia, apathy, and lassitude. Nausea, vomiting, thirst, and occasional diarrhea will start. The respiration is first at deep, later on it becomes labored and dysphonic. There is vertigo, ringing in the ears, deafness, impaired vision, and common headaches may also become severe. Temperature usually raised. There is irritability, restlessness, confusion, disorientation, delirium, mania, hallucinations, generalized convulsions, and coma are also seen. In severe poisoning, respiratory alkalosis may also start developing. Later on, there is metabolic acidosis supervenes, where carbon dioxide, respiratory alkalosis because of carbon dioxide accumulation, and increased annan and graph metabolic acidosis with respiratory alkalosis, ketosis, and tinnitus suggest salicylate poisoning. So this the features if present usually confirms that if there is an increased annan and graph metabolic acidosis with respiratory alkalosis, is usually suggests acetate acid poisoning. The urine is strongly acidic, contains acetone, albumin, and frequently trace of bile due to mild hepatitis. There may be hypovolemia, hypokalemia, and hypoproteinuria may also occur. The skin is flushed and moist pupils are seen. They will be dilated and the pulse is rapid and irregular. There may be platelet dysfunction and prolonged clotting time may also seen. Severe dehydration may occur, and in terminal stages there is hyperpyrexia of 41 to 40 degrees may occur. Blood level of more than 50 mg% are toxic and over 100 mg% is fatal. Fetal dose of sodium salicylate and aspirin of 50 to 20 grams of acetylsalicylic acid. Salicylic acid is 70 to 80 grams. Methyl salicylate is 10 to 20 ml. Fetal period is few minutes to several hours based on what the person has consumed. There is one phenomenon called as race syndrome. It is sometimes seen in children which below 15 years of age on consumption of aspirin. The main features are acute onset of hepatic failure and encephalopathy with residual neurological manifestation. So this syndrome manifests as a hepatic failure followed by encephalopathy and neurological manifestation. Treatment of salicylic acid: first is emetics, then stomach wash should be done with sodium bicarbonate solution. Then activated charcoal is useful. Then alkaline diuresis is done to remove the poison. Plasma clearance rate is about 700% above normal. Perineal dialysis and hemodialysis are also useful. Exchange or transfusion is done in severe cases. Saline catheterization is also helpful to remove the poisons. Alkaline therapy is if acidosis is present. Whole bowel irrigation may be useful if salicylate levels are not declining. Vitamin C is given to control hemorrhage. In idiosyncrasy reactions, ACTH and antihistamines is given. Idiosyncrasies in some people, because the aspirin is not absorbed properly and the concentration increases in that cases, acetate and acetaminophene is given. Then symptomatic treatment is provided. Cause of death in salicylic acid: death occurs from acidosis and uremia with peripheral failure due to shock in early stages or respiratory failure later. Aspirin can also cause sudden cardiac arrest. Idiosyncrasies in about 0.2% in whom there is therapeutic dose produces alarming symptoms, which includes angioneurotic edema, urticaria, hypotension, edema of the mucous membranes, and in severe cases, erosion of the mucosa and ulceration may also seen. So, idiosyncrasies where the therapeutic dose can cause adverse reactions in some individuals, mainly in 0.2% individuals, these symptoms are seen. To do a better test to detect if the person has consumed salicylic acid, a few drops of ferric chloride, if we added to the urine containing the aspirin, it turns deep blue, deep purple. Postmortem appearance: the pupils are dilated, skin rashes may be seen, gastric mucosa is congested and may be eroded. There may be black uttered blood may be found in the stomach. There is generalized congestion of all the organs since it is asphyxial sign. Subpleural pericardial petechial hemorrhage may also be seen. Lungs are again congested with edema and collapse because of asphyxia. If the patient survives for a few days, myocardium, liver, kidneys are usually soft and dirty in appearance and greasy to touch. Hepatitis may also be present. Petechial hemorrhages are seen in various organs, again with sign of asphyxia. Chronic poisoning are seen in taken for the person consume aspirin for longer duration. Symptoms are confusion, agitation, lethargy, disorientation, slurred speech, hallucination, convergence and coma. There may be tinnitus, loss of hearing, dyspnea, tachycardia, and fever may also be seen. Circumstance of poisoning: aspirin poisoning is almost always suicidal. If the person wants to die, the person may consume a lot of tablets of aspirin. Because of its bitter taste, large quantities are usually not swallowed accidentally. So, usually the person will not accidentally consume large doses. If wanted intentionally, it may be consumed, leading to suicide. Next, an analgesic is the paracetamol. Paracetamol or acetaminophen is an analgesic antipyretic without any anti-inflammatory properties of aspirin. So it is also analgesic as an antipyretic, but it doesn't have anti-inflammatory properties. It is absorbed rapidly from gastrointestinal tract and metabolized quickly in the liver. It is a potent hepatic toxin. A small part is converted by liver enzymes into an acetyl p-benzoquinone. In overdoses during metabolism, NABP accumulates and causes severe centrotubular liver necrosis. So, continuous use of paracetamol can lead to hepatic failure because of there may be chance that liver necrosis may develop. Cause of death in paracetamol poisoning: large doses act on the brainstem and cause rapid death, or most deaths are delayed for several days when liver failure may occur. Toxic doses cause a depletion of glutathione, which results in hepatic necrosis. So, toxic large doses can cause depletion of glutathione, which may result in necrosis and liver failure. Symptoms: within few hours, patient mainly in cases when the person has consumed large doses, these symptoms are seen. Within few hours, the patient experiences anorexia, nausea, vomiting, abdominal pain, diaphoresis, hypertension, tachycardia, and dyspnea. After 1 to 2 days, there is discomfort, which disappears. After 2 to 4 days, there is vomiting, jaundice, hepatic pain, bleeding, hypoglycemia, confusion, coma, metallic acidosis, and close swabbing temperature of hands may be seen. There may be cardiac arrhythmias, hemorrhagic pancreatitis, disseminated intravascular coagulation also seen. That occurs within 3 to 4 days. Renal failure may be also seen due to renal papillary necrosis, which occurs in 24 to 72 hours, even in the absence of hepatotoxicity. Death from hepatic failure occurs 4 to 18 days post ingestion. Fetal dose is 20 to 25 gram or 40 to 50 tablets, which has to be consumed to be fatal. Fetal period is 2 to 4 days. So within 3 to 4 days, patients are usually treated. Treatment: gastric lavage to remove unabsorbed tablets, activated charcoal. Then N-acetylcysteine is the antidote usually given for treatment purposes. It is a specific antidote and has a maximum efficacy used within 8 hours. Methionine is also is present, but it is less effective than N-acetylcysteine. It acts by increasing the glutathione synthesis. Then acidemia has to be corrected. Hemodialysis is done to remove the poison. Then symptomatic treatment is given. Postmortem appearance, there is yellowish liver with acute central lobar necrosis, acute tubular necrosis in the kidney, myocardial necrosis, and cerebral edema. These are because of decrease in the glutathione present. Liver may be enlarged and may be pale yellow. Renal tubular necrosis and occasionally myocardial fiber damage may also be seen. Circumstance of poisoning, again paracetamol has replaced barbiturates and aspirin in Britain has a favorite method of suicide. Again, it is mainly used for suicide purposes. Mainly in Britain, it is commonly seen. These are my references. Thank you.